Okay.
Aloha, everybody. Tonight we are talking about staying healthy the natural way because as we get older, we realize that nothing is more important than our ability to function normally. Because, as you know, the older we get, the harder it is to stay healthy for a lot of us. Well, Stacie Han is a naturopathic doctor and licensed acupuncturist. The Punahou graduate earned her doctorate in naturopathic medicine and master's in acupuncture and East Asian medicine at Bastyr University in Seattle, Washington. She has practiced in New Jersey, Illinois, and Seattle, and is now treating patients at her Gaia Naturopathic and Acupuncture Clinic in San Diego. Altogether, Dr. Stacie Han has been practicing for 14 years. Thank you so much for joining us, Stacie.
Thank you so much for having me.
Yeah. Okay. Well, let's get started.
Yeah.
And break it down for us. What generally happens to our bodies as we age?
Yeah. I mean, gosh. Our hormones start to come in, start to be produced by our ovaries around 12 or 13 after our first menses, right? And then it starts to peak in our 20s and our 30s. And then after around your mid 30s to early 40s, your hormones start to decline. Your sex hormones, your estrogen, your progesterone, your testosterone, your adrenals make cortisol and DHEA. And, I mean, our bodies have a finite life, right? Shelf life to them, right? And so as we age, our organ functions start to decline. And so we will start to feel, men and women will start to feel more tired, more fatigue, right? That's the number one symptom as our hormones decline. Inability to sleep well, weight gain, depression, anxiety, um, diabetes and cardiometabolic markers start to go up. So yeah, so our sex hormones start to decline, and so we start to feel just less resilient. And I mean, the list goes on, and we can talk about all the symptoms that come with perimenopause and then menopause as your ovaries shut down to make hormones. But it can be a really big transition. And I think for women, especially in Hawaii, where where there are a lot of Asians, and we're told to just suck it up and you push through, and oh, menopause, it's nothing. You can get through it. Mom went through it, grandma went through it. It's fine, you know. But it can be a really big transition for many women, and it can be really tough, so a lot of women, they're like, okay, I'm anxiety ridden, I'm depressed, nothing has changed, so they go to their doctor and they're given an SSRI or benzodiazepine because they can't sleep, like Xanax or something. And it's like, okay, well, that's not really, for some women they need it, for some women it helps them, but sometimes it's not. It's something like bioidentical hormones that can help with mood and emotional lability and depression, just feeling like down in the dumps, funky, like not being motivated to exercise or do some of the things that you usually could do. Or sleep is a big issue. You can't sleep very deeply, or you wake up between 2 to 4 a.m. and then you can't go back to sleep. That's a huge one. And instead of being given trazodone or Ambien, hormones, hormones can make a big difference. And then the weight gain, the 10-pound weight gain. I haven't changed my diet. I still exercise, but I'm gaining weight around my middle or my butt or my thighs, and that's hormones too. And sleep and poor sleep. If you're not sleeping, you're going to crave carbs, and then your glucose goes up and your insulin goes up, and then insulin gets stored around the fat. Anyways, yeah, it's just a vicious cycle. So
Yeah, I
there's a
mean,
lot of things
yeah,
that happen.
there's a lot. I mean, you pointed out so many things, the whole spectrum. It just like, oh yeah, so many people listening probably can relate to all of those things. But before
Yeah.
we go any further, can we
Mm-hmm.
paint a clear picture for our
Mm.
listeners about the difference between, Western medicine and naturopathic? and why you feel that the naturopathic way is the best way.
Yeah, I mean, everyone chooses their own path of feeling well. I'm not, it was just how naturopathic medicine and the way we practice medicine made sense to me, made sense to the way how I grew up. I treat food as medicine. I feel like diet and nutrition are the foundations to feeling well, right? And taking penicillin when I was sick, or that was a lot of the medications I took, but I didn't feel like it treated the root cause, or then I would have gut issues and then antibiotic resistance. And it didn't, that kind of medicine for me and my family and the way I want to raise my kids just didn't make sense. It didn't treat the root cause for me. It didn't take away the root cause. And it just treated symptoms, or it suppressed the disease process. We don't just look at just your hormones or just your brain or just your GI or just your heart. We put it all together. All of your organ functions affect one another. Your GI affects your brain, your heart, your pancreas, I mean, your thyroid, right? It's all interconnected. And so as a naturopathic doctor, we learn to look at the body as a web that communicated constantly with each other. And in our medicine, it's a slower process. It takes time, not a quick fix. It's not like a pill and you're gonna, get better. And usually if you take a pill, you're gonna have side effects. So it's a slower medicine, but it treats the root cause, and hopefully it helps you feel better for the rest of your life. It's a practice. It's not easy. It's not a quick fix, but you will feel better.
So
Um,
the women listening to our podcast right now, the fact
mhm.
that we can relate to the symptoms and the changes with our body is maybe the first step, right? Right, Stacie? Like it's the first
Yeah,
step to listening to your body and trying to get in tune with it. And wow, okay, something's not right, right? And then maybe investigating, or what do you have to say about the next step?
absolutely. The awareness piece is key. Listening to your intuition. If you think something, if you don't feel right, your brain fog, you can't recall as much, you're not as motivated, you want to nap at 2 to 3, you just want like that 20 to 30 minute cat nap, right? Um, Listen to your body. If you feel that and you feel like, oh, I'm feeling weak, I'm 47, I'm 48, and this is not how I want to feel, like, yeah, reach out to your primary care, reach out to a naturopathic doctor, your acupuncturist, your massage therapist. um and yeah, usually it's energy. Yeah, I'm just fatigued. And then it's the anxiety and the depression, right? Or just not feeling well. Yeah. The hot flashes and night sweats that start to come up, the heavy periods, the irregular periods, right? Then you get anemic, then you're more fatigued. And it's just, not every woman, but and then the sleep. Sleep is a real big one. Yeah.
So
Yeah. So, go ahead.
no, no, no. So are so what would you prescribe? Would it be basically like, as you were saying before about the root cause is like maybe, I mean, and
Mhm,
the reason why it's leading to this could be like a number of things, but your diet, like
mhm.
how do you go about like prescribing or
Yeah, yeah. So before I even get to hormones, like hormones are like the icing on the cake. It's just like what makes your body and your mind function smoothly and optimally. And like it's just kind of like you hear about anti-aging, longevity medicine. I mean, it makes you feel resilient. Yeah. It makes you almost feel like you're 30 or not. I mean, it gives you a lot of energy back. Yeah, your brain back, your mood back. You're more stable. You're not as irritable. Um, so, but before we even get to hormones, we got to make sure that you're eating an anti-inflammatory plant, like fiber forward based diet, that you're taking out the processed sugar and the junk and the soda and the sugar, all of that, because that's pro-inflammatory. And if you don't fix your diet and you don't eat clean, And you don't get your cholesterol or your lipid levels or your insulin or your glucose and your hemoglobin A1C and your inflammatory markers like sed rate and CRP at an optimal level, and you put hormones on top of that, the hormones are not going to work very well. They're not going to go very far, and you can cause more problems later, like for example, so a lot of women are diagnosed with fibroids, like it's just extra uterine growth in the uterus, and then you can have super heavy periods. And usually if you lose weight, if you lose any excess weight and you get your digestion going and you're eating an anti-inflammatory diet, and you put hormones, well, if you put hormones on somebody who's overweight, insulin resistant, has high cholesterol, and then has fibroids, it's not gonna be safe. Yeah. So even if you didn't have fibroids, you just want to make sure your body is running optimally so that the hormones take you farther. Yeah. So you start with the diet, you start with exercise, sleeping, getting your sleep hygiene in place, right? Decreasing alcohol. When you're on hormones, your liver is the main organ that detoxifies your hormones. And so you don't really want to be drinking a lot of alcohol on top of that, because that's going to back up the hormonal metabolism system too. So like all the stuff that we talked about in the first podcast I had with you, I do that with all my patients first, and then we add on the hormones, ruling out history of breast cancer or family history of breast cancer, ruling out fibroids or ovarian cysts, right? So making sure that they're getting their mammograms every year, and if you've got ovarian cysts or fibroids, making sure you get your transvaginal ultrasound to make sure there's no uterine overgrowth before we even start hormones. So there's definitely screening you have to do. Yeah.
And is that screening available with your primary, typical Western medicine, or do we have to seek out a naturopath doctor?
Yeah, very good. Good question. How do I say? So I think primary care physicians are becoming more aware of the benefits of bioidentical hormones. But they won't talk too much about diet and cleansing and detoxing and all of that. And not everyone does bioidentical hormones. So bioidentical means that's the only kind of hormones I do. It matches exactly what our bodies make, our ovaries make, versus synthetic hormones like birth control, which a lot of primary care physicians give to perimenopausal women who have heavy irregular periods, right? To just make them not have heavy irregular periods and be anemic. Or sometimes they give Premarin, which is pregnant horse urine, right? But that's oral. I never prescribe oral estrogen because it can increase the risk of clotting and stroke, right? So pulmonary embolism, you don't want clotting to happen. So not all the primary care physicians are doing bioidentical. Some are doing like synthetic. So if you really wanted to go the bioidentical hormone route, which is a cream or a patch or a troche, which you put between your buccal mucosa, but some of it gets absorbed orally. So it's or a pellet that's inserted transdermally in your buttock, subcutaneous. You'd have to see a naturopathic doctor or a functional medical doctor, or they call them functional nurse practitioners or physician's assistants, right? There's more of those practitioners coming into the mainstream, but it's not really mainstream. It's still like very kind of niche. Yeah. But I think more practitioners are becoming aware of it because the public wants it. It's driven by demand, right? Yeah. And education. And that's why I'm here, because we don't know much about hormones, right? So yeah. And this is the most crucial time for us in our mid 40s to educate ourselves about the benefits, the risks. about of hormone replacement therapy.
Yeah, so Stace, I have a question about the
Mm.
hormone replacement therapy. I mean, that sounds
Yeah.
super interesting, and you're right, I don't know much about it. So
Mm-hmm.
obviously, obviously, you probably can't give like a straight, flat out answer because every person is different. But
Yeah.
in generalities, like you know, would it go something like you prescribe a certain dose and it's something that they have to maintain? And what does that do? Does that replenish the amount of hormones that say I had when I was like in my 20s, or like what are you looking at, like, and then I'm gonna feel like that? And is it something where like once you start it you got to be on it forever, you know what I'm saying?
Yeah. Yeah.
Like can you
All good
yeah.
questions. Yeah. So, let's see. Hmm. So you usually start on estrogen and progesterone. I do either patches, which you can do through your pharmacy, like Longs or CVS or Walgreens, yeah. And you change it's a sticky adhesive that you put on your abdomen, and you get a continuous dose, like, and you change it about twice a week. It's called a transdermal patch or transdermal estradiol, sorry. And then you always, when you give estrogen, you always want to give progesterone because it protects your uterus from endometrial overgrowth. And with overgrowth can become precancerous cells, right? So it protects the uterus. It protects the breast from proliferation, from differentiation. So overgrowth of abnormal cells in the breast. So you always want to give progesterone too. And then I usually test about 6 to 12 weeks after you're on those hormones to make sure that your levels are optimal. And it's a blood test. It's a blood test. And what you should notice within a few days, the lowest hanging fruit is the vasomotor symptoms. So the hot flashes, the night sweats, yeah? Those are the ones that are taken away really quickly, and that's with estrogen. Estrogen is what causes all those hot flashes and night sweats. And then, after about a week or two, you'll see an improvement in your energy. You'll see an improvement in your sleep, where you're sleeping deeper. Some women, they wake up 1 to 2 times to urinate. That's gone. Urinary symptoms, vaginal dryness, improved libido, better brain condition, right? Oh, musculoskeletal pain. Like sometimes women who are working out in their 40s, and after they're getting, oh, my back's hurting, my knees hurting when I turn over in the bed, like that's gone, right? Or that's improved, much improved. You're not needing that nap at 2 to 3. You can go like you were in your, maybe your 30s. You can go all the way till 8 or 9. Your mood is better. So yeah, there's different ways to do hormones too. I mean, there's different ways you can apply it or take it, right? But there's also different ways to some people, very niche niche way to do it is to cycle your hormones, like it's called cyclical dosing. So you kind of mimic a 35-year-old woman's cycle, and that's a little niche. That's not very common. So, but a lot of women get benefit from what we call static dosing, the same amount of estrogen every day. And then you either cycle in your progesterone, where you only take it 2 weeks out of the month, because that's what progesterone does. It's pretty much day 1 through 14. Day 1 is when you bleed till you ovulate. Progesterone's no, it's nothing. It only comes up after you ovulate. So you can either take progesterone every day, or you can take it, 2 weeks out of the month. And you can take progesterone either like a cream, or you can take it orally. When you take it orally, it metabolizes down into an amino acid called GABA. I don't know if you guys ever heard of GABA, like a GABA theanine to help calm your nervous system. When you take it orally, it helps with sleep, really helps with sleep, and anxiety.
And then so
But
So once you start it, then it's pretty much a lifetime thing.
Yeah, this is the thing. So before, like, I don't know if you guys heard of the huge study that was done in 2002. It was like millions of women. The World Health or Women's Health Organization did a huge randomized controlled, placebo-controlled trial about hormone replacement therapy. And so they had to stop the study after about 2 years. It was a $1 billion trial. They spent so much money. They stopped it about after 2 years. It was supposed to be much longer because women were getting strokes. They were getting embolisms because they were taking the hormones orally, and that's the estrogen, especially Premarin. They were taking Premarin, the horse urine, orally, so they had to stop it. And then the data was misrepresented. They came out and they said estrogen is causing breast cancer. And when you look now, the data is coming out. They're fine tuning and they're sifting through that data, and it wasn't. It wasn't the Premarin group. The women who were only on the estrogen, they had less risk of breast cancer. It was the women who were on the Premarin and the progestin, the synthetic hormones, that had a slight increase in breast cancer, not much, not statistically significant, but the media came out and said, stop, we gotta stop, estrogen's causing breast cancer. Anyway, so that scared women for 20 years. So women were, my mom's generation was like, scared of hormone therapy. And so then they said, okay, shortest amount of time, 3 to 5 years. If you start hormones because you got hot flashes, night sweats, can't sleep, depressed, okay, 3 to 5 years. But now it's saying you can be on this for the rest of your life. Like, because once you stop hormones, you will not get the cardiovascular benefit, the brain benefit, the dementia. Women are more prone to dementia than men. Because our estrogen, when we stop making, it goes like this. Men, their testosterone goes like this. So for us, we really feel the mental effects.
And
So
sorry, I'm just going to interrupt, but for the listeners, so Stacie was just actually, because they can't see your hand motion, but
oh, I'm sorry.
no, she's basically saying that for women when we get older, like our estrogen drops off a cliff, like basically.
Yeah.
Men, it's a more gradual decline.
Yes. So oh, and then bones. There's nothing better than preventing osteoporosis than estradiol. When I talk about estrogen, I mean bioidentical estradiol. Yeah. So a lot of women have to take bisphosphonates or Prolia, which they don't like, which helps to build the bone, but only on the shell, not the internal, the inside of the bone. Yeah. So estrogen helps that. So unfortunately, when you stop the hormones, you don't get the bone effect. You don't get the brain effect. You don't get the cardiovascular effect. Yeah. Women who go through menopause, their lipids go up too. They get more hypertensive. Their blood pressure goes up. And the number one cause of death of women is cardiovascular disease, not breast cancer, not colon cancer. It's cardiovascular disease. And the declining estrogen causes increased lipids and hypertension, which affects cardiovascular system.
How costly is like hormone therapy? Because I mean, I would love to, but I mean, I think it sounds like you'd be signing up for something that's like you got to stick with, and then I'm sure it comes with costs.
Yeah, well, I mean, there's several ways. I mean, you can get it covered by insurance. If you're perimenopausal and you're having hot flashes and night sweats and your libido's low and you can't sleep at night and all of those things, you can get the patch and it can be covered by insurance. And you can take oral progesterone, which is bioidentical. It's called Prometrium, and it comes in 100 and 200 milligram caps. You can take that and it can be covered by insurance, or I mean, maybe you have to pay a copay, but it can be covered. Most of it should be covered. Now, as far as like after menopause, like maybe when you're 60, 65 and you still want to do it, I'm not sure about that. But from our patient base, for women who are on Prometrium and estrogen, their insurance covers. So
What is the age where you should be considering something like this, or what is the recommended age to start doing this? And then when is it too late?
yeah, yeah. So around perimenopause. So menopause starts average age starts around 50 to 52. That's when you stop your menses. Like 1 year of no menses is you are in menopause, or yeah. And then perimenopause, so those hot flashes, night sweats, the sleep, all that sleep, the cognitive decline, that can last anywhere between 5 to 10 years. So you're looking your early 40s, your hormones are starting to decline. Yeah. So you can start in perimenopause. Um, and so, like a lot of women are starting in their early 40s, mid 40s, late 40s. And a lot of women kind of miss the boat, and you can start safely about 5 to 10 years after menopause. So if you stop menstruating at 50, you can go up until 60 and start. I guess the biggest risk is clot with the estrogen, but if you're doing transdermal estrogen, like a patch, your chance of clotting is very, very low. It's just the oral estrogen that's, yeah, yeah. But I mean, women can start in their 70s, especially if they're osteoporotic and
Mm.
they don't want to lose more bone, and have a fracture. And then their life expectancy goes down after a fracture, if you're in your mid 70s. So, yeah, yeah.
Stacie, are there certain like telltale signs or symptoms that women, I guess our age, at this point, our age, can tell when we're in perimenopause? Is it like when you're right before menopause? Is there something that starts to happen and you're not quite there? I know it's the 1 year without their period.
Yeah,
And there's some people
yeah.
that are
Oh,
on
yeah.
birth control, so you don't even have a period, right? So
Right,
how do you
right.
have any recommendations on how to tell if
Yeah,
you're in
yeah.
that category?
Right. So, the thing is, if you're on birth control, yeah, you're not going to know. Yeah, because it's masking. You're getting a little bit of estrogen and a little bit of progesterone. So you're not going to feel those hot flashes, the night sweats that maybe happen around a week before you menstruate, the heavy, irregular periods, the decreased sleep, the brain fog that happens, right? Um, the irritability and the depression. But the common perimenopausal symptoms are the low energy, the musculoskeletal pain, the fatigue, the mood stuff. And then if you're not on birth control, you can test your hormones. So you can test a day 3 to 5 FSH, follicle stimulating hormone. It's just a blood test, and your estradiol, and see what your levels are. If your FSH is like, reaching 20 and above, you're pretty close to stopping. Yeah. And then, if estrogen's low, under 10, or estradiol is low, or, even under 30 or 40, you're kind of pretty much there too. Yeah. Um, And then you can also do a day 18, 19, 20, 21 progesterone and LH. So day 1 is the first day you bleed. And then you can count 3 to 5 days for FSH and estradiol, and then the luteal phase is the progesterone. Yeah, it's a little tricky. But this is why you kind of want to see a hormone specialist, to do all the testing, to do the thorough intake, to put you on the right dose of hormones, and then to test after. Yeah.
Is that
Yeah.
separate from what you specialize in, like a hormone specialist and a naturopath?
Naturopath.
Is that-
No, well, no, because I do it all, like, because when I was in Jersey and Illinois, I couldn't prescribe hormones. It was not in my scope, but here in California, I am. So I can prescribe hormones and thyroid, any kind of hormones. So that is in my scope. Some naturopaths don't do hormones. They just stick to thyroid, or they just stick to cardiovascular, metabolic syndrome. But maybe because I'm going through perimenopause right now, and it's just, I see the benefit of hormones, and it's like, oh my gosh, this is a game changer. So I work with another naturopath, and this has been her practice for 25 years. And I mean, a lot of women are benefiting from it. Yeah.
These,
I have,
yeah.
uh-huh.
Are there natural remedies, say if you want to ease yourself and into this, but are there things that people can do to is there a natural way to
Yeah.
make your
Mhm.
body increase hormones?
Yeah. Yeah. I mean, you know, for sure, if you're chronically stressed, right, and you're not sleeping well, your body's not going to make hormones very efficiently. Your adrenals won't make the DHEA, and your adrenals do make a little bit of estrogen and progesterone. So you really want to. The sleep is important. The calming the nervous system. Try not to be flight or fight all the time. Like our society is always go go go, and we don't have time to just rejuvenate and rest. So the more we can just try to relax or put that into our day, our ovaries can function a lot better, and so can our adrenals. And I didn't talk about thyroid, but thyroid's huge. We always screen for hypothyroid because a lot of women have thyroid issues as well. I mean, it's just another endocrine system that declines as we age too, right? Thyroid is important for metabolism, for energy, temperature regulation, hair, skin, nails, digestion.
So should
Yeah,
I, so
so
should you cut out caffeine altogether then? Because I mean, you talk about
mm,
so much about relaxing and caffeine is a stimulant, but like there's benefits with green tea and things like that. So I don't know, I'm like, what should people cut that out?
I mean, I tell my patients like 1 cup a day is okay. I mean, not with the sugary creamer, right? Just whole coconut milk or almond milk or whole milk if you're okay with dairy. Um, and try to nix the sugar. But I think 1 cup is okay. But if you're drinking 3, 4 cups and you're trying to, drink one at 3 because you're tanking your energy, like, might want to look at other things. Yeah, like your hormones or your thyroid or cortisol to try to balance cortisol or healthy sleep at night, right? So,
And
yeah,
is another way to try and increase your sleep, maybe does exercise tire you out naturally? Because I will admit that I have a hard time falling asleep. And I don't know if I'm wired because maybe I do have to cut back on the number of green teas, hot green teas that I drink. But
uh-huh.
um, yeah, I mean, because I mean, you would think naturally when you exercise, you exhaust, your body systems. And so maybe that's a good way to tire yourself and also reduce stress, right? I mean, I'm looking
Absolutely.
for simple ways that people can apply,
Right.
add to their life to get
Yeah,
things to kick in and help.
for sure. For sure. Exercise does wonders to help with sleep and just um regulating the circadian rhythm. And I would advise a lot of people to try to exercise in the morning because when you exercise late at night, it makes your cortisol rise again, and so you'll have that second rise in cortisol when cortisol should be declining at 3 p.m. But if you exercise at 6, you're going to get a bump up, and then that's going to keep you up at night. So really getting that sunshine, looking at the sun rays when you're
Mhm.
exercising, right? Because that'll help with your pineal gland, which will secrete more melatonin at night when you look at the sun during the day. Yeah.
And is sugar really as bad and evil of a culprit as not so many people, but I mean, there's a lot of things that point to sugar as being the leading cause of certain conditions, and that probably might
Yeah,
work against your whole like hormone thing too, huh?
absolutely. Like insulin resistance and diabetes and prediabetes. Yeah, I mean, sugar sneaks. Look, that's what makes food sell. And that's what I that and then then people have to get on metformin and all these diabetes meds. I mean, it's industry, and so it's a conscious decision for us because it sneaks its way into everything. Salad dressing, drinks at Starbucks. I mean, it's so easy. And then we're so hooked. Our taste buds are so hooked on that sugar that we don't even taste it anymore, right? Until we eliminate it for a good, couple weeks and then, introduce. So it's pro-inflammatory. It increases insulin, right? Insulin too much is pro-inflammatory.
Adding
So yeah,
rice.
I'm
White,
sorry.
does that include rice? You know, right? A staple
Rice, white rice. Yeah,
brown rice.
white rice does have a high glycemic index, so it does have some carbohydrates or sugar, but I think everything in moderation, right? I mean, we don't want to be so strict that it stresses us out too. So, maybe a blend of brown rice and white rice, and making sure we have enough vegetables at our meals, and lean protein. Yeah, yeah.
Is there anything that you've come across in all your years of helping patients that you see as like maybe a really easy thing that people aren't doing that like, but maybe it's easy, but it's so challenging, but like only if they eliminated this or they did it differently, then, it would help them a lot. Like, is there just something common that people are constantly doing that you're finding yourself giving the same advice or, I mean, what is there a common ailment that you're seeing out there that's just pronounced or that you're just like, wow, this is like a problem that so many people struggle with, like.
Yeah, that's a great question. That I'm thinking about that more. I think one of the things is we're just so go, go, go. We're so like produce, make more money. Once I get this much money, then I'll have this house or this car. And it just never stops. The constant like want, right? And the growth of materialism and looking outside and not looking within. So I think how it translates is like not getting enough sleep. Like sleep is really important. And if you don't get enough sleep, you're going to crave carbs the next day. You're going to crave sugar because that's the quickest way for your brain and your muscles to get energy. And then when you get a flood of carbs, you drive up your insulin and your blood sugar and your LDLs and your triglycerides, all these, cardiovascular markers. I mean, it's the cascade of cardiovascular risk. So, and not to mention like the stress it causes on our nervous systems, right? You can't sleep, your mind's racing. What if this? What if I said this? What if I did this better? Like just the constant self-talk, the self-judgment, right? I see that as the obstacle to cure, the obstacle to feel better. We just are, we're like these resilient moms and businesswomen, and we have to do everything perfectly. And we can't. It's just not possible. And to give ourselves grace. And it's okay. We're doing our best. And just to be present with ourselves, with our kids, with our partners. Yeah. That's what I see the most. Yeah. I do it to myself. It's hard. It's not easy. It's not easy.
I was gonna say for all the years I've known Stacie, she's an achiever. She's an achiever, which is awesome though, because she doesn't stop. I mean, she has goals and she achieves those goals, and she, broadens her horizons and herself, and it's great though that you're sharing all of this. And I mean, you're a good example because you can do it, and you're a mom and you have your own clinic, so you're like so busy too. So the fact
I
that
know,
but you're good at, like, I noticed that you're good at, you exercise. I think you pay attention. So you're like, oh, I gotta dial back on this or like adjust. I think that kind of mentality can help a lot of people who are listening to this podcast. It has to click, like, oh, be aware of like how you're feeling. Oh, okay. Oh boy, I ate too much chips. That's I'm gonna make a mental note to like just not have this after 8 o'clock. Let's just stop eating. You know what I mean?
yeah.
Yeah, it's all about like healthy
Yeah.
habits. And but boy, I mean, I did not know at all about the whole hormone thing. I mean, and Brooke, I mean, you have similar interests, so yeah, I don't know if you had any more questions too, Brooke.
No, I wanted to say I appreciate Stacie's perspective, and I agree with like everything you're saying. And we were nodding like, pretty crazily, because I was like, I just wrote a post about that for my functional health, like, coaching stuff that I do, but it's just talking
Mm.
about like if you can be doing all the things, the diet, being good about your nutrition, and also knowing what's inflammatory for you, making sure you get the right amount of rest, like 7 hours of quality sleep, and having good sleep hygiene, and you can be exercising, but not over, make sure you don't over exercise because that's a stressor too. But exercising and moving, you can do all the things, but if you don't take care of your mind and your beliefs and have someone support you in unraveling some of that, it might be a little messy and emotional, and that's the hard stuff. But if you don't have that support too to really help, that's really the block, right? And I just was writing that before this call, so it's funny you said it. But that's really, I think,
Absolutely.
what's, especially for women, especially for goals, women who have goals and who are caregivers and who are working and taking care of everyone. I think it's so easy to go back to like all the things we've learned. And I think there's a lot of heavy Asian influence too, which is just come on, don't bother anyone, don't make it hard for, so I think I went through some of that. I did the work on myself too, which helped. That was the most freeing thing. So I'm just sorry to keep blabbing, but that was the most freeing thing, is to, while you're working on your wellness journey and figuring out as we age how to help yourself get well and increase your health span and your longevity, you have to take care of your mind and your heart too. Because if you don't, you can do all the things and it's really not going to get you huge results, right? Yeah. So thank
Absolutely.
you for your perspective. It's
I have to
Yeah.
put away
agreed.
my phone, man, because that I just keep on staying up like after work, but that's my way of unwinding, But then
Yeah.
I get off so late and then I'm up the next morning taking the kids to school. So I guess I really need to put that phone away because my clock is already ticking in terms of sleep the moment I get home. So it's like, okay, you only have a short window, so you might as well just work at it and stop doing
Mm-hmm.
these things, right? I mean, oh my God.
Yeah.
Things.
Yeah. It's tough.
Mhm.
It's tough. Yeah.
But give yourself
Yeah.
grace too, right? Everyone, you have a different schedule, I think, and you need your me
Mhm.
time too. So don't beat yourself up, right? If you need to just unwind for a little bit, right?
Yeah.
Yeah. Yep.
Is
Mm-hmm.
there any I guess last words of advice or encouragement that you want to give our listeners to end the podcast?
Yeah, I mean, I think we ended it. I mean, the hardest thing is to go inside because um, it's really inside of us where the answers lie. And sometimes there's a lot of murkiness there and there's a lot of trauma. We all have micro traumas, all of us. We all came from dysfunctional families, no matter what we
Mhm.
want to say, right? And so it hurts sometimes to go within, but that is where you find liberation and um and that's sometimes where you find the motivation to make these changes, to make the diet changes, to make the lifestyle changes, right? And like I said, the hormones are just icing on the cake. You don't need icing. Sometimes some women are fine without hormones, but it is an option. And I want women to know that they can feel better and stronger and mentally stronger and physically and emotionally stronger. There are options. And if your primary care is not interested in doing bioidentical hormones or helping you out, seek out a functional practitioner or a naturopathic doctor. Because a lot of us are helping women and helping them feel better.
Mm. All right,
Yeah.
Stacy, is can people look you up? I mean, I know you're based in San Diego, but
Yeah. You can reach me in through my website. You can send an email to me. My phone number is there. It's drhannd.com, drhannd.com. And yeah.
all right. Well, we miss you
Yeah.
in Hawaii, but you're doing well
Aw,
in
miss
San
you guys
Diego.
too. Just a 5 hour plane ride.
Yeah. All
Yeah.
right, Dr. Stacie Han, everybody. Thank you so much, Stace, and
Thank
stay
you
healthy
Thank
so
you
too.
so much.
much.
Okay,
Thank
Take
bye.
care.
you. Okay,
Bye. Take care.
bye.